we can learn from stories and anecdotes and, cases. And there's no shortage of incredible turnaround situations of cases that all of us could talk about who have done this work. And just, I'm incredibly impressed and blown away. If someone's able to do this intervention, I almost always see incredible positive results that I can't say that about other treatments that I use.
I just wanted to start this episode with a message of thanks. Thank you to everyone that chooses to listen to this podcast. By doing this, you're enabling me to reach more people so that they might learn how to unchain the pain to live a healthier, happier life. The feedback that I get from those that take action and are inspired by the show's content is incredibly rewarding. So I'd like to ask you a teeny tiny favour. You are truly able to change the course of this podcast, the types of guests I have on this show, and everything that I do by doing one simple thing. And that is simply hitting the subscribing button. The guests on this podcast are incredible because so many of you have hit that button. When I think of what I want to do this year on this show, this is fueled by the amount of you that subscribe, that tune in, and that comment on the show's content. So please keep subscribing, keep commenting. Any type of comment, please keep them coming, and keep sharing the shows that you find inspiring. I can't wait to see what this year brings for this show, for you, for my community, and for this platform. Thank you. Welcome to the show, Brain Health Unchaining Your Pain. I am really looking forward to this conversation because we have the fabulous Dr. Matt Bernstein on the show. Welcome to the show, Matt.
Thank you. Well, glad to be here. Yeah.
So for those that don't know Matt, and I know we connected via Dr. Georgia Eade, Matt has been a clinical psychiatrist for over 20 years, has been teaching appointment at Harvard Medical School and McLean Hospital. He's the Chief Medical Officer at Ellenhorn and is also now the CEO and Chief Medical Officer at Accord, an innovative program that uses an immersion in metabolic therapies to improve mental and physical health. And this is so close to my heart based on the story that you shared with me. So I'm so looking forward to having a discussion with you about this because I think metabolic health is so important and so overlooked. But before we dive into that, I would love to know what you are passionate about in life right now. What makes you get out of bed in the morning?
Well, I mean, the topic at hand for sure. But within that topic right now, I'm learning a lot about circadian rhythms. That's my passion du jour, I would say. And how impactful those are for physical and mental health. And, getting our circadian rhythms in line and in tune is very hard in the modern world. But so important. And I think one of the most overlooked things, I think, in our modern health conversation.
Yeah, I totally agree. And we're about to try and get my circadian rhythm not kicked out of whack because we're on different time zones and it's quite late in the evenings.
Right. Well, I appreciate you talking to me so late.
Oh, no, it's fine. It's fine. So before we dive into metabolic health, could you just describe what metabolic health is for those that are not familiar with it, please?
Sure. Well, I mean, metabolism encompasses a lot. Fundamentally, it's about taking nutrients and turning them into energy in our cells.
Yeah.
And so the fundamental important thing for any cell to function optimally is having enough energy. So no matter what that cell is supposed to do, whether it's a neuron or a liver cell or a cell in the heart, it needs enough energy, which is ATP, to do its function properly. But metabolism actually encompasses more than that. It also encompasses things like building the things that a cell needs to build, the enzymes, the receptors, the neurotransmitters or hormones, whatever that cell's function is part of its metabolism as well. And so in some ways, metabolism means so much, it's hard to even, it almost can mean nothing, because it means really everything that's healthy within a cell is part of a metabolic process. And so a healthy metabolism for a person involves, really being able to efficiently turn food into energy and create health throughout the body, essentially. Yeah.
I think that's so important. And I think it's so often overlooked in the context of psychiatry, until probably fairly recently, although I don't have the figures, but we've been talking about the importance of diet and food for millennia, but it just seems to have been forgotten that the importance of feeding our cells and making our cells perform optimally, and the impact that has on our cognitive health, our mental health, our emotional health, our physical health, our spiritual health.
Yeah.
It's kind of the fundamental building blocks, but we don't talk about it enough.
I think that's right. I think part of the reason why it gets lost in the medical conversation and in psychiatry and psychology is because we're often on the wrong track about what advice we're giving people. And so we tell people just, eat the right amount of calories, or just eat a Mediterranean diet and everything will be fine. But we're not really giving good enough and specific enough advice to truly solve the problem. And I think even the doctors and the therapists who are giving that advice don't think that if we just change the diet or get the person exercising, that their major depression is going to go away or their bipolar disorder is going to become stabilized. And so there's not much belief in it. There's not much force behind it.
Yeah.
But I do think that has been changing in the mental health world amongst a certain pocket of folks in the last 5 years, especially. Yeah.
And I'm curious to know where that journey started for you, because you mentioned you're grappling with the limitations of mainstream medicine. Where did that journey really start?
Well, it's a personal story, as I'm sure a lot of times, someone who might have a story to tell, it starts personal. So for us, it started with two of our kids. We have 3 sons. This is about 7 years ago now, and very happy, well-adjusted boys. They're all boys. And at the ages of 12 and 14, 2 of my sons, right around the same time, went from being happy, well-adjusted, good students and playing their sports and their activities and their friends, to having severe functional limitations. It looked very much psychiatric for both. And it was very severe. All of a sudden, very out of the blue. We had no idea this was coming. They were both, doing well. And then literally within a week, they couldn't go to school. They were that impaired. Wow. And so, we went through all the, processes that one might expect. I'm a psychiatrist. My wife is a psychologist. We know people. We got very good care. All the right protocols were tried, and they got literally no help from, my own profession and my wife's profession.
Yeah.
In all of this. And we started digging deeper and realizing that we weren't going to get help in the mainstream. And there were different types of doctors and different types of diagnoses that eventually, led us out of this quagmire. But it took years and lots of resources. And, and I don't think it's easy for, people to do that. We were lucky that we had those kind of resources and the ability to dig deeper, the education and the financial resources to figure all of this out. And eventually they got a diagnosis of PANS, which is also called PANDAS. For your listeners, PANDAS is autoimmune condition set off by a streptococcal infection. PANS is the blanket term for any autoimmune encephalitis that's set off by any infectious agent or even sometimes toxins. Turns out for our kids, it was Lyme and co-infections that set off their PANS. And eventually they got to the right doctors who really knew how to treat that. And with very aggressive treatment, they got better. But they weren't getting better at all from the best of mainstream medicine.
Yeah. And I've had another episode talking about PANS and PANDAS, and I think it's something that's very overlooked and very misunderstood. Yeah. And I think often the representation, the clinical representation that people have is misconstrued as something else. Like you mentioned, it looked like it was something else, but actually it's your autoimmune system is attacking itself because the infection gets into the brain and
That's right.
crosses the blood-brain barrier, and it sees it as it sees the good cells in the brain as bad cells because of the similarity of the attacking streptococcal infection that they may have, strep B.
That's right.
Whatever it happens to be.
The immune system sees some receptors in the basal ganglia as very similar to what's on a streptococcal bug, but it can happen with other infections too. So
absolutely,
the idea of molecular mimicry, they call it.
Yeah.
So I mean, but that was really eye-opening. For me as a clinical psychiatrist, I'm taking care of lots of people who are very ill, and in the paradigm of psychiatry is, as you know, it's just chin up, basically only looking at the brain, not thinking about the whole body. And I was certainly stuck in that paradigm, trained in that way, and then my mind was blown that this is not, this looked for my kids just like severe OCD and depression. But it turns out that it wasn't. And in psychiatry too, we don't think about the cause of any of this stuff. We just say it's just this illness called OCD. Well, what caused the OCD? A psychiatrist will just say, well, it's your genes and your environment, but we don't really know. We don't have an answer for that in my field. And in my personal life, that became a big problem, that we didn't have an answer for that. I mean, we had to find an answer for that. But now, I really feel like that opened my mind to the idea that we need to find an answer for that for many other things and for many more people. What is really the cause, and what are the other potential solutions besides just, changing people's neurotransmitters with, strong chemicals that have side effects.
Yeah. And I think that's so important because we're such a complex system, and often sometimes the medical approaches only target one neural pathway.
Right.
So we have multiple routes into and out of our brain. And going back to the our cells are our energy centers. It's not just one energy entity that feeds our cells. We get fed by multiple nutrients, and those multiple nutrients do different functions in order for our body to work effectively and our cells to work effectively. And so when we end up targeting just one of those pathways and don't look at the whole system, we lose the opportunity to address the whole system and understand the map rather than the single road that we end up going down, and what the route is, the best route around the mountain might be, or over the mountain, rather than just one way. So I'd love to know how that led you into where you are today and founding Accord and the work that you do, because obviously that's a huge journey, and it must have been quite a traumatic one for your kids as well, going through having PANS / PANDAS.
Yes, it was very traumatic for them, for myself, my wife, and our other son who didn't get sick. It was for all of us, for sure. Mm-hmm. And it took years, to be clear, to, start finding our way out of it, and eventually, finding our way out of it for one of our sons. The other son, really got quite a bit better from those treatments, but then still really grappling with the trauma that he experienced, and, is having all kinds of struggles around that trauma still. But eventually, at a certain point, it wasn't, another full-time job in addition to my regular job to, help take care of them and figure out what was going on. And so I had more time on my hands, and I was used to the idea of having a second job, looking into, under the hood, so to speak, in medicine. And I started turning my attention towards different topics. So I started studying longevity for, sort of more of a selfish topic for myself and my wife, and learning all about that. And then, I heard a lecture when I was at Grand Rounds at McLean from Dr. Chris Palmer, who wrote the book Brain Energy. And he's really at the forefront of metabolic psychiatry. And he was talking about in this Grand Rounds about a few cases, and really reversing severe mental illness. He had one case he was describing as someone who had a schizophrenia diagnosis and had been ill for over 50 years, was on the strongest medication that exists, and was describing her going on a ketogenic diet and having all of her symptoms go away and eventually going off of that medication. And if I didn't know Chris Palmer personally and know that he's a straight shooter, I wouldn't have believed it. I was just mind blowing to hear this. Could not fathom how could a diet, fix that kind of brain condition. Just didn't compute with what I knew. So started, really digging into all the science behind that and learning everything I could. And, it's just incredibly impressed by not just the power of this clinically, for people, which we can get into. I know my own clinical experience working with my patients, but also just how much basic science knowledge there is about how this works and why this works.
Yeah.
Which I'm not used to in psychiatry. We don't have that level of basic science knowledge about how our treatments work, or even how our illnesses, what the pathophysiology of these illnesses are.
Yeah.
And so it was really fun to go back and learn all that science too. Reminded me of, when I was in medical school. So I really dug deep into it and have been learning a lot. I'm still learning a lot. There's so much to know.
Oh my gosh, there is, isn't there? For me personally, the big change for me from my mental health perspective was my diet.
Yeah.
I, prior to changing my diet and going pretty gluten dairy free, I'm not ketogenic, but I am trying to go to ketogenic because I'm fascinated about the impact it's going to have on my brain function. I used to be on antibiotics pretty much every year. I had sinus issues, I had grommets when I was a kid, multiple ear, nose and throat infections, tonsillitis, tonsils removed, you name it, pretty much everything under the sun, sinus washouts. Since taking particularly dairy and particularly gluten seems to be a very high inflammatory for me, I have not been on any antibiotics for over 7 years. And the impact is astonishing. The change in mental clarity, the change in just how I feel, the lack of lethargy, the lack of feeling like I'm stuffed with cotton wool.
That's fantastic. Yeah,
it's amazing, and I never knew that until I got involved in brain health and read Dr. Daniel Amen's book, and we've all got our own preferences. Right. Yeah. But I just find it astonishing how little people know about the impact of food on our brain health. And like you say, the cases where you can really turn your cognitive function around, where you have really severe brain struggles, like the struggles that you mentioned, by purely changing the way in which your body processes energy and switching from the glucose metabolic pathway to the ketogenic metabolic pathway. So yeah. I'd love if you could kind of talk about that, if you wouldn't mind, a bit more, because I'm sure you're more learned than I am.
Absolutely.
And explain to people how that pathway shifts how our cognition works.
Absolutely. Yeah. I mean, it's really a shift that's going on throughout the entire body. I mean, we'll focus more on the brain. There's a lot studied. So just a little background that the ketogenic diet's been used in epilepsy for over 100 years. It was invented in 1921 at the Mayo Clinic, and it was published, and it was the primary treatment for epilepsy for decades, actually, until pharmaceuticals came along in the 1950s. And people became enamored by pharmaceuticals, but it's still considered, one of the, standard treatments in epilepsy. It's been studied in about 13 controlled trials in epilepsy and shown that it works. And so because of that, there's been an incredible amount of neuroscience done on why ketones help the brain, how they help the brain. People have been trying to figure this out for a few decades now. And so we know a lot about it. So, I mean, we can get in, maybe later we'll get into how ketones are made and why they're made, but just fundamentally in terms of the mechanisms of how ketones help the brain. So there's a number of them. Some of the favorites are improving mitochondrial health and function, causes what's called mitophagy, which is the mitochondria to keep dividing and making more healthy mitochondria, and also to get rid of the unhealthy mitochondria. And as your listeners may know, mitochondria are the the energy factories in the cell. They're what's making that ATP that powers all the cells. But in addition, Chris Palmer has elucidated in his book a tremendous amount of research about what other things that mitochondria are doing. They do all kinds of other important functions in the brain. So they're involved in helping decide when neurotransmitters should be released. They're involved in deciding what genes get expressed in the nucleus of the cell, which hormones to be released, which hormone receptors to put out on the edge of the cell. So they're doing many, many things. And so the health of the mitochondria may be the most important thing that ketones are doing, but there's more. They also reduce neuroinflammation. So, what I was describing about my kids, that's essentially a neuroinflammatory process. And we know that depression is a neuroinflammatory process. The more we study it, we see that almost all mental health conditions have an inflammatory component, and ketones are very good about reducing that inflammation. They're also good about reversing oxidative stress. So, oxidation is sort of like, what happens with rust on metal. That's happening inside of our cells and in the mitochondria all the time. These reactive oxygen species, they call them. And ketones are very good at quelling that in the brain. So there's another mechanism. We also have a change in the GABA to glutamate ratio that happens from ketones. So more GABA, which is the calming neurotransmitter. It's the way these benzodiazepine medications work, is through the GABA system. And then reducing glutamate, which is the excitatory neurotransmitter. And that tends to be incredibly helpful for mental health conditions.
And I think the key thing there is GABA, you have to do it in the brain, because if you're using GABA supplements to facilitate your calming state, that's telling you that you have a leaky blood-brain barrier, because GABA doesn't cross the blood-brain barrier normally unless it's leaking.
That's
so I
right.
think the great thing about ketones is it helps you.
The ketones are getting into the brain normally. They're a source of fuel for the brain, right? And that's exactly right. So we're doing something that's changing the GABA to glutamate ratio in the brain. If you took exogenous GABA, most of that, or if not all of that's not going to get into the brain. It's not going to help you. And that's why, you can take all the GABA you want and you may not feel much benefit from that. Now, some people do feel some benefit, but most people, I haven't found it to be a very powerful supplement for most people. So that gets us to this other thing of cerebral glucose hypometabolism. Now, that's a mouthful, but essentially what that means is that your brains, your neurons like to run on glucose, like most of our cells. We're using glucose for fuel, right? Well, you need insulin to get that glucose into the cell. And if someone's very insulin resistant, they're not able to get the glucose into the cell. There may be plenty of glucose around. One might have just had a big carbohydrate meal with lots of glucose, but there's not enough insulin around, or the receptors aren't working well enough for the insulin to get that glucose into the cells. And so ketones bypass that because they're a different source of fuel for the brain, and they don't require insulin to get into the cells. And
so there's another different pathway to feed your cells, give your cells the energy that they need, because it bypasses the glucose pathway.
Exactly. So it's like, an alternative source of fuel is the way people look at that. So some people use the analogy of a hybrid car. The car can either run on gas or on electric, and our brains and our whole bodies really can run on both. But because of the way we eat, we end up only using glucose and not the other source of fuel. So eating this other way with a low carbohydrate diet allows us to use other sources of fuel like fatty acids and ketones.
Yeah. And I think, isn't it true that the way in which ketones fuel your cells is quite different in terms of the energy release? Is that right?
It's a cleaner burning fuel in some ways. It's sort of cleaner for that environment. It's not creating all those reactive oxygen species in the same way as burning glucose. And there's, neurons really like ketones.
It's more efficient, isn't it?
Yes. It's more efficient and it's cleaner. And that's one of the really important things. And then, just to get back to our last list, completing our list of how ketones help the brain, there's this whole idea of the microbiome gut-brain axis. And one of the ways that it looks like ketones really help with brain health is that they actually improve microbiome health, and they improve that microbiome gut-brain axis as well. So those are just That's just some of them. There are more. We think that ketones increase brain-derived neurotropic factor, which is basically, signaling to neurons to grow more, to make more synapses, make more connections. And the more you look into it, the more people are finding, different pathways of how this works. And no one knows for sure which are the most important pathways. I do trust Chris Palmer on this, and he has done a lot of research to demonstrate and show how it's, the mitochondrial pathway is probably one of the most important ones. But for various individuals, different pathways may be more important and we're still learning so much. We're, in the very beginning of this field of studying this for mental health.
Yeah, and I think that's so fascinating. I just want to slightly digress into COVID.
Yeah.
Because we know that COVID attacks the mitochondria and causes mitochondrial dysfunction. And we also know it attacks the ACE2 receptors. So has there been evidence to show? I don't know the answer to this question.
Yeah.
Has there been evidence to show that switching to a ketogenic diet helps restore mitochondrial function? Do you know, in the context of COVID, because we're facilitating a better pathway to the mitochondria?
I don't know if there is science about that. I would be very interested to find out, but I don't know the answer to that either. Yeah.
Exciting. All right, lovely. So I'd love to move into the different types of conditions that people can experience.
Sure.
And I know you mentioned epilepsy has been treated,
yes,
using ketogenic diet for over 100 years. But there's so many other mental health conditions or brain health challenges that people experience that can be reversed or dampened down, shall we say,
right.
Using metabolic interventions.
Yes, there are. And, really the way I look at this is every time it's studied in a new brain condition, it seems to work. So, the list is growing, but it's not the same level of evidence as in epilepsy, because that one's been studied for so long. We're in the much earlier stages of studying this in other mental health conditions. So there are case series done in severe mental illness of, for example, schizophrenia, schizoaffective disorder, bipolar disorder, and major depressive disorder, showing that this has tremendous power. But these are, like I said, it's not the same level of evidence. These are not randomized controlled trials. That particular case series was a series of inpatients in a hospital in France who the doctor put them on a ketogenic diet and documented very carefully the incredible results that they had. And they, in the paper, they essentially said these same people are serving as their own controls because they had all been admitted to that same hospital before and never had the kind of results that they had when they were put on the ketogenic diet. So tremendous reduction in their symptoms, incredible improvements in their metabolic health. And they were all discharged on lower doses of medication, psychiatric medication, than when they came in, which, if you may know and your listeners may know, almost never happens. When people go into a psychiatric hospital, they get put on more medication, not taken off of medication.
Yeah. And which is amazing, amazing for the individials, but B, also the clinic or the hospital, in the context of a great success story, where you're turning that person's life around and putting them back into a society where they can actually manage with less interventions.
That's right. I mean, when it happens, it's an absolutely glorious thing. And we'll get to, what the challenges are later. But, the way I look at it now is, I would try it in any mental health condition. I mean, there's case reports in anorexia, case series in anorexia. I wouldn't do it in someone who's underweight in anorexia at this point. People are doing these studies currently on weight restored anorexia. There's a big study going on. And when I should say there's, because of these early case series, there's now huge interest in this field. And so there's now about 15 different, very well done, randomized, controlled trials going on in various academic medical centers around the world on ketogenic diets and various mental health conditions. And so we're starting to see just some of those results come out now, but we're in the next, couple of years, we're going to see tremendous amounts of results coming from those studies. And I think a lot of excitement because I feel confident that the results are going to look exciting.
Mm-hmm. And I think there's other results, aren't there, for common conditions like ADHD
Yes.
or ADD.
There's been studies in
autism,
Alzheimer's disease, ADHD,
mm-hmm.
autism. There's been some studies in depression. There's a recent case series that came out with people with severe depression. And this is just the stuff that's published.
Yeah.
And in addition, we have clinicians out there. There are not that many of them, but my own experience, Chris Palmer, Georgia Eade, there's Nicole Laurent in California,
mm-hmm.
And many dietitians who are out there doing this can describe, dozens of their own patients who are doing this and having incredible success.
Mm-hmm.
And so, in medicine, we care a lot about what's published, and we should, because it needs to go through that peer review process. But in addition, we can learn from stories and anecdotes and cases, and there's no shortage of incredible turnaround situations of
mm-hmm.
cases that all of us could talk about who have done this work. And just I'm incredibly impressed and blown away. If someone's able to do this intervention, I almost always see incredible positive results that I can't say that about other treatments that I use.
Yeah, which is phenomenal, really, given how relatively simple the intervention can be once people get on board with adopting a ketogenic diet. So I'd love if you could dive into that a little bit more and tell people what a ketogenic diet is.
Sure.
And also what it isn't.
Sure. So, I mean, I don't want to say that it's simple. I mean, I think for someone who's been doing it for a while, if you've been doing it for a couple of years, it can feel simple. I mean, that's the case for myself. It doesn't feel hard after doing it for some years. However, when one is first learning how to do it, it doesn't feel simple. It can feel hard. And that's actually one of the biggest barriers to this, is that people are used to going to their doctor and getting a prescription and going to the pharmacy and taking a pill. And, once they've gotten the bottle in their house, it takes about, 15 seconds a day to take their pill. This is much more time consuming. There's much more to it. There's much more learning involved that needs to happen.
Mm-hmm.
But the basic idea is that it's a very low carbohydrate diet. We reduce the carbohydrates down to minimal levels, usually less than about 20 grams a day.
Mm-hmm.
It's a moderate protein diet. It can't be high protein or one won't make ketones. So moderate protein. And then the rest of the calories need to be filled in with healthy fats.
Mm-hmm.
And so it can include, and it should include, I think, plenty of vegetables, as long as they're the non-starchy, low carbohydrate vegetables. You can even include a little bit of fruit. Berries in particular are pretty low in carbohydrate. So then we need to get fiber into the diet. We need to get good quality food, hopefully whole foods, not processed foods. That ends up becoming very important. The types of fats is important too. We need healthy fats. If fat is going to make up, 60 or 70% of one's calories, we need to pay attention to what are these fats and how are we preparing them and how are they being processed.
Mm-hmm. Mm-hmm. And what would you say it isn't? Because I know some people kind of think, oh, I'm in ketosis, and actually they may not be.
Well, right. So I think it's also really important to differentiate, someone who's just saying, I'm going to try a ketogenic diet just because I want to see how I'm going to feel. Maybe I want to lose a few pounds, see if I have more energy, versus someone who's doing it for a medical condition. Mm-hmm. And I think there's a real difference there. One of the differences is that, when I prescribe a ketogenic diet, I'm asking people to measure their ketone levels.
Yeah.
And that's very important, because we don't know how many ketones someone's making unless we measure. And just like any medical intervention, if we can measure it, we want to do so to find out what's correlating with the benefit, or, is someone even getting the treatment, right? If I can test a blood level on a medication, I often will try to do so, especially if someone's not getting better, because then I can find out, well, do they have the right level of this medication in their blood? So it's very similar. I want to know what level of the ketones, which in this case is, part of the medicine, is in their system.
Yeah.
So it can't be just, so if someone's casually doing this, they might do just a low carbohydrate diet. And that can be very healthy. That can be very good for someone's energy. Someone might lose weight. But that's not necessarily the same thing as a ketogenic diet where we're really focusing on making ketones.
Mm-hmm.
And often what ends up happening if someone just cuts out the carbohydrates, they end up eating a lot of protein and not enough fat to make ketones.
Yeah, that's super interesting. I mean, I'm not in ketosis, and I'm certainly not on a ketogenic diet. And I know I'm at the beginning of the journey where it's going to be extremely difficult to move, particularly to transition the family entity into that space, which is often the sort of secondary challenge, is trying to adopt a diet when nobody else is.
That can be very challenging.
So.
Yeah, absolutely. If especially if you're cooking food for other people and they don't want to eat that way, it becomes really tough to do it. It's much more helpful if the whole family does it together, but not everyone might want to. So exactly.
And are there any ages where people shouldn't? So let's take children, for example. Is there any evidence where children should not go into a ketogenic diet, or do we know that this is beneficial for all ages to facilitate cognitive function?
This is prescribed for kids, even for infants, in the epilepsy world. There's so much experience doing this for epilepsy that the infants who are having infantile seizures that will sometimes get put on a ketogenic diet. So kids of all ages. For sure, there needs to be a really skilled dietitian involved if that's the case, because it's very important for a child to get enough protein and enough of the right nutrients for growth. And so it's often a fine balance between, enough protein for growth and not too much protein to impede ketones. And so it needs to be done very carefully in growing children, but it absolutely is done all the time. In fact, pediatric epilepsy is the #1 condition for which ketogenic diets is prescribed.
Amazing. So we can empower our children to actually help us make the transition, which is what I'm so super excited about. And that's obviously where your story started. I'd love to dive into your search for other approaches and how you started learning the Walsh protocol and the importance of macronutrients versus micronutrients. Could you just take us on that journey there?
Yeah. I mean, as I said, I was, after this experience in my family, I was really looking for other ways that might be helpful to people besides the standard approaches. And one of the things that I studied and learned a lot about is the Walsh protocol, started by William Walsh in, I think he's in Illinois, the Walsh Institute. He runs lots of trainings. He's trained a couple of thousand of clinicians around the world in this protocol. Wow. It's very focused on micronutrient things. So things like whether someone's an undermethylator or overmethylator, copper overload, copper zinc balance. There's something called cryptopyrroles is very powerful. And if someone has elevated cryptopyrroles in their urine, they end up becoming deficient in zinc and B6, and they need very high doses of that. And for the people, and I've used that protocol in a number of people, and for the people you have really significant findings, sometimes we can make a huge difference just focusing on the micronutrients. But I didn't find it to be effective for everyone. There were people where we would do the blood work and we would do the questionnaire, and it wouldn't lead us in a strong direction as to which category they fit in. And therefore, the protocol never really had huge benefit. And, I've had some people where, especially with the cryptopyrroles, if someone has very elevated cryptopyrroles, that one seems to be incredibly powerful from my perspective.
And how do you find out whether is there a specific blood test? Do you have to do genetic testing?
No, for that particular test, cryptopyrroles, it's a urine test.
Okay.
And there's different labs that do it. There's one particular lab that has the best reputation at being very accurate at that, called DHA lab. And so you just, ship off the urine to DHA lab, and they'll tell you, how much cryptopyrroles are there. It's also very important in the Walsh protocol. I don't want to sell it short. There's a lot of questionnaires and understanding what kind of phenotype someone has, and if it fits with the lab work. Sometimes the phenotype is just as important as the lab work. But that one in particular, I think is a very powerful one.
Yeah.
And then, I've also studied with Dr. James Greenblatt, who has a whole integrative functional psychiatry approach, really digging deep, sort of similar to the way a functional medicine doctor does, looking at stool and urine and blood with all these very alternative testing, not from a standard lab. Here we have Quest and LabCorp, sort of the standard labs.
Yeah.
These are these smaller lab companies that are certified, but they're not accepted by mainstream medicine, the types of tests that they're doing. Functional medicine doctors use these labs all the time, and they're incredibly useful if someone knows how to use them. And Dr. Greenblatt's protocol looks at all these things in great depth. And I think there's incredible amounts of important things that can be done using that functional medicine lens in psychiatry as well. But what I found with that is that it's a lot of effort. There's a lot of digging around, and all of that is hard for people. So, when I'm working with someone who's got a pretty significant mental health condition, and I say, well, you've got to go to this lab for this, and you have to register there, and then you've got to go to a special place to get your blood drawn, and then for this other lab, we got to use a different one, and you got to register there and go to that place to get your blood drawn. Even just getting the diagnostic testing done could be, a daunting task. And
it's quite difficult. And it's the same in the UK, there's traditional, and let's take the NHS, the traditional NHS testing does not cut it in terms of understanding people's, detailed blood work in order to unravel why they're experiencing the symptoms they are.
Right. Yeah. And so if someone has the ability and the resources and the fortitude to get all that testing done, we may find all kinds of important and helpful things that are clues to the origin of their condition. And I think that that's a tremendously important approach. And for the people who are able to do that, I think it's a great thing to do. But what I find is that most people aren't willing to do that. They're not willing to follow me down all those rabbit holes, and really uncover every stone and figure out what are all the possible things that could be going on. They want to know, what can I do that's really going to help me?
Yeah.
And that's really where I think this metabolic treatment really shines, because if we just change the diet in this very specific way and we're making ketones, I feel very confident that they're going to feel benefits.
Yeah.
And they're going to have benefits on their lab work, benefits on their physical health as well.
Yeah. And I love the fact that you teach people, because so often, going back to your comment on medicine, and the simple route is you take a drug, it takes 15 seconds, you're done.
Right.
There's no teaching, there's no empowerment of the individual to take back control of their health. In actual fact, drug interventions take the power away from you.
That's right.
Because you're no longer in charge anymore. But I love the way that your program really focuses on empowering people to take back control of their mental health and well-being, through education, through community engagement, through the learnings that you give people, how to adjust their diet and do those simple changes that they can do. So could you talk to us about what led to the creation of Accord and what you do?
Sure. So like I said, I've been doing this in my private practice for a few years. I started doing it at this other company where I work, Ellenhorn, which is this very comprehensive psychosocial rehabilitation program.
Yeah.
But not everyone is interested. Not everyone wants to change their diet. Not everyone wants to, put the sweat in to do it themselves and be empowered. People are, a lot of people do want to just take the pill in reality. And so it's not for everyone, but for the people who really want to do it, I wanted to create a place that we really could do everything that would help someone's metabolism. And so that's where this idea of Accord, came up. So it's an immersive program. We have a house where people come in, they're going to stay there for at least 4 weeks, but some people may choose to stay for 8 weeks or 12 weeks. And we're going to do every possible thing that we can think of to improve metabolic health. So a well-formulated ketogenic diet is the sort of, hallmark of that. And everyone's going to be put on an individualized version of that fits with their tastes and their desires and their preferences. We have a amazing nutritionist who's going to help, a dietitian who's going to, build that plan with them. And then an incredible chef who has been eating a ketogenic diet herself for the past 5 years. So
Wow.
she not only has all the cooking skills, but also knows all her ways in and out of all of this ketogenic style of cooking. And she's an amazing gardener, and she makes everything from scratch. So she's making, homemade granola and yogurts and sprouting broccoli sprouts and, making fermented veggies and everything all by scratch. So that's incredible. So this well-formulated ketogenic diet is the mainstay. And then we also have, movement and exercise. So we have a wonderful personal trainer who has a lot of expertise in helping people with mental health conditions get back to working out. That's his expertise. And he's a lovely, lovely man who, really engages people. We have a social worker who's our program director, who's sort of organizing all of this. We have a whole module on mindfulness and stress reduction. So we know how powerful that is for brain health overall, but we know part of the way that works is improving mitochondrial health. So it's another signal to the mitochondria that they're safe and they can reproduce and do their job the way they're supposed to.
And it significantly impacts your gut health as well, of course.
And gut health. I mean, all of this works together.
Yeah, of course.
And then finally, we're going to be working with people on their circadian rhythm alignment. So, I talked a little earlier about how, that's something that I'm really intrigued by and fascinated by. So getting people to cut off the blue light a little bit before bed, getting people up and awake and seeing morning sunlight as early as possible. Eating protein in the morning also helps set their circadian clock for the day. Yeah. So we know that the more people's circadian rhythms are in alignment, the healthier they are overall. And so all of that's happening at once while we're also measuring all kinds of things at the same time. So we're measuring ketones. We have continuous glucose monitors on people's arms. We're measuring heart rate variability and resting heart rate on these fancy watches. We're measuring their sleep quality. We have this machine that measures body composition, so we can see percent body fat and visceral fat, which are incredibly important markers of metabolic health, and we can measure and see how that changes over time. And so all that measurement is really important to also keep people motivated. They can see the benefits in their numbers and see how that correlates to how they feel. And that's part of what's going to make what can be a daunting task to completely change one's lifestyle, hopefully a little bit easier for people.
Yeah.
Yeah.
I love that. And I love that it's so immersive because it takes away the distractions that we have so often in life that make it very difficult for us to switch a habit.
That's right.
Something that we're so used to doing because it's become comfortable to creating a new habit that is comfortable but much more healthy.
Immersion is really helpful for that. And also the idea of doing it with someone else, doing something hard with someone else makes it a little bit easier. Someone else is doing that same hard thing that you're doing, can make it a little bit easier. So that's part of the idea, is that people will start the program right at the same time often and be part of sort of a cohort. They're doing this together. And there's a big component in our program too about education. So teaching people how this works, why it works, some of the stuff we've talked about today. But in addition, how to do this when they get home. So lots of cooking education, cooking classes with our chef, lots of classes on going to the grocery store together and learning how to shop and read the labels and see what's healthy and what's not, how to order in restaurants, because we know people are going to end up eating in restaurants, and how can you order and stay on the plan, or at least not stray too far from the plan when you're in this kind of restaurant or that kind of restaurant. So the idea is that people will get immersed, but then when they get home, they're also going to be able to continue the progress and keep doing it when they get home.
I think that's such a powerful approach, because it's so easy for us to get snippets of information and try and implement it, but it actually becomes too difficult, going back to what we said earlier, because there's too many barriers around us in the home. It just, everything becomes too hard to do because we don't have sufficient knowledge, we don't have sufficient tools. And so by doing all of that in the way that you're doing, and I think it's absolutely fascinating, really exciting, you're not only getting people educated, but you're also forming your own case studies as what's working well and what's not working well, going back to the case studies in the hospital that we talked about earlier.
That's exactly right. We are collecting all this data. We're actually working with some people at McLean Hospital, where I'm affiliated, to have an IRB to collect prospective research data on this, so we can publish it as well. Because the idea is too, we're still at the stage in this field where we're trying to figure out which are the biomarkers that really correlate with benefits. We still don't know that. I mean, we think that a certain level of beta hydroxybutyrate, which is one of the ketones in the blood, is correlated, and there seems to be some evidence of that. We need to get that BHB level above 1.5 or so for most people, maybe above 2 for certain people. Maybe people with other less severe conditions, we may be able to have it a little lower. But what are the other biomarkers that might correlate? Maybe it's change in visceral fat that's very important. Or maybe it's something about what we're finding out on the continuous glucose monitors. That's a very powerful tool as well. Glucose is very important in this story, even when someone's doing a ketogenic diet. So we're hoping that we can also contribute to figure out, what are the key things to be measuring, and make this easier so that people can do it in outpatient settings and at home much easier in the future.
And I think the great opportunity here, because I want to go back to children, because I have a daughter age 5.
Yeah.
Is educating children. So I have an Apple Watch. She wants a watch to track how she's doing, and she's
right.
5.5.
Right.
But they're growing up in a world where tracking health stats is going to be the norm. So we have an opportunity to, I think, really leverage the work that you're doing, but broaden this out to the younger communities, to educate them, the next generation of the future, to help them make much more informed choices, much more brain health aware choices around what optimizes their health and well-being, and what will minimize any symptoms that they experience. Going right back to the start of your story, is our understanding the impact that our external environment has on our brain health, where we can contract Lyme disease, and how that impacts us cognitively, how we can help our gut, minimize leaky gut to stop that penetrating into our system, etc. So many things that we can do. And I love the fact that you have this program that is going to help people. So what's next for you?
Well, I don't know if I'm on to what's next yet. We just started. So what's next is, making sure that this program really becomes what the vision is for it. And I think we're well on the way for that. Hopefully, the idea would be to bring this metabolic treatment to more people after that. If we can show that this is successful, maybe we can figure out how to do it in a less intensive environment. Maybe we can figure out how to do it where someone drops in for the day in a clinic near where they live for a few hours, learns how to cook, gets a plan for what they're making for dinner, learns all the things they need to learn, and, doesn't need to be there 24/7 for 4 weeks. So we make it more user-friendly that way. Or even, there are people now who have coaching programs online, teaching people how to do this as well. And, for the right person who's a self-starter and able to learn and able to make changes on their own, that can be, exactly what they need. They don't need to come to a place like ours. So, I think, my hope is that, we can just make this much more known, number one, to people, that this is an option. Their option isn't just this medication or that medication or this TMS procedure or this, psychotherapy. They also have this option. And, that's a really, important goal, but also then to make it accessible for the people who are interested in it and want to do it. We want to make this something that they can access. And, in America too, it's that insurance company will pay for. Right now, insurance doesn't want to pay for something like this. So we have to get more evidence to convince them that it's worth their while to want to pay for this.
It's the short-term pain equals long-term gain, isn't it? It's that catch-22 situation where if you invest in educating people, then, otherwise, why do we put our kids in schools?
That's right. That's right.
Why do we do that if it's not going to result in a long-term gain?
Yeah. And of course, there's a whole other issue that we're not talking about, which is sort of the food environment that we live in as well in the Western world, and that, we're all swimming against the tide in some ways. but we don't help. It's not just the food that's around, it's also the recommendations that's coming out of the medical community. Is sometimes really not on the cutting edge of what really works for people. And so, if you ask most psychiatrists out there, would a ketogenic diet help your patient with their bipolar disorder? They're going to say, well, that sounds pretty doubtful to me. I don't think so.
Yeah. Rather than doing the research and going, I don't know, but I'm going to go and find out.
Right. Because this is the way, doctors are trained too. We're trained to think about the only thing that's medical is a pill or a procedure. We're not trained to think about food as medicine, and not just medicine, incredibly powerful medicine.
Information.
It's powerful medicine, right? Powerful information to every cell in our body, right?
Yeah.
But doctors aren't trained to think that way. I wasn't trained to think that way. I wouldn't have believed that if you told me that 10 years ago. I would have absolutely said, no, forget it. I'm not even not even entertain that. Yeah.
No, I think it's I find the whole thing fascinating, and every day is a school day, and a really enjoyable one when you learn more about the importance of food, nutrition, micronutrients, macronutrients, how you can take back control of your own health. What would you say the foundations people can start with, like the fundamentals people need to focus on that they don't maybe pay enough attention to? And I know we could talk probably about this for a really long time, but like the real basics that people can start with to optimize their cognitive health.
Yeah. So I would say probably some of the most basic things are limit any added sugar in the diet.
Yeah.
Eat as much whole foods and as few ultra processed foods as you possibly can. And move your body, exercise, even if it's just walking, and that's all you can do, then walk, do it all the time. Those three things are incredibly powerful. And for many people, that might be enough to lift them out of a slump or a mild case of the blues that they have, or some anxiety. If they just did that, they may get enough. But then, there's more steps that people can try. If those things aren't enough, there's a lot more that we have out there for them. But those are great places to start.
Mm-hmm. Mm-hmm. That's so helpful. And I think there's so much more we can learn. And I'm so pleased that you're doing this program. How can people get hold of you and learn more about the Accord program that you do? How they can learn more about cooking courses, everything else, your immersive program that you have?
Sure. So we have a website, accordmh.com. So people can find out a lot there. If they want to talk more, there's a button to hit to get to make an inquiry, and that would be responded by one of our staff. So usually our program director, Sophie, will respond to those emails, or one of the other people in leadership will respond. So, I think that's a great place to learn more about Accord. If people just want to learn more about metabolic psychiatry in general, I already mentioned Chris Palmer's book, Brain Energy. We talked about Georgia Ede, and she has a wonderful book as well.
I have a book here which my daughter's been given, actually.
To
read.
That's a wonderful book. And then there's a great website called Metabolic Mind that puts out all types of videos, a couple of videos a week, that has a tremendous amount of great information about this whole idea of metabolism and mental health. So that's another, I would strongly recommend people check that out as well.
Yeah, so we'll put all the links in there, and we'll obviously put all the links to Accord and all of your social media links, etc. So do make sure you check that out. Dr. Matt Bernstein, my goodness, it's been an absolutely fascinating conversation. It's something that I'm so interested in. So thank you so much for sharing your knowledge on this show and giving people great insight into how they really can change their brain and change their lives.
Well, I really appreciate the opportunity. I had a great time speaking with you. So thank you so much. Yeah.
Oh, you're most welcome. Remember, everyone, this show is all about brain health, unchaining your pain. You're not stuck with the brain you have the power to make it better. And Dr. Matt Bernstein has kindly been here to show us how. Thank you.